Hi, I hope everybody, as I said, is having a good day. And welcome. I'm Claudia Perry, Director of the Institute for Family, and I'll be your host for today's webinar. I'm really glad you could join us today for this special edition of a webinar. It's our Mission in Common webinar series. And whether you're returning as a person who's been engaged with the Institute previously or joining us for the first time, we're really, really glad you're here. So this series is proudly presented by the Institute for Family. We're an organization deeply committed to strengthening families as the foundation of thriving communities. And at the Institute, we believe when families are supported by every key sector, socially, emotionally, economically, and culturally, entire systems begin to shift towards wellness and justice and resilience. So our work centers on creating spaces for reflection and collaboration and learning across disciplines. And we bring voices together from public health, education, child welfare, advocacy, and beyond to ask, how do we build systems that truly serve and uplift families? And so at the Institute, we really try to look at whole family uplift, not just the child, but uplift of the whole family. And so that's where Mission in Common comes in. This webinar series is designed to speak to and spark conversation among professionals who share a unified mission to empower and support families by reimagining how systems can function together on behalf of families, better together. Each session features a dynamic leader who challenges conventional boundaries and brings bold ideas to the table. We are really interested in sparking conversation. We dive deep into how interdisciplinary collaboration and community engagement and equity-centered approaches can transform family well-being from the inside out. So today, we're having a series of these, but today our focus is on public health and how systems that shape our health outcomes really need to evolve and be more integrated and just and people-centered for families. And actually, to use a really great analogy that you'll hear quite a lot from our guest today, hopefully he talks through this analogy because it was really resonant for me. We're going to explore public health as a living forest where every tree and root plays a role in the ecosystem of community care, right? And we can't be more excited about, welcoming Omari here. We were really excited when he agreed to share with us today. We believe his voice, has been a really instrumental force in reshaping how we understand health equity and public health careers right now, which is something that we all need to be talking about. So before we get started, just a little bit of housekeeping. I want to take a quick moment. After our conversation with Omari and his presentation, we'll open things up for a Q&A session, and we'll address as many of your questions as time allows. Throughout this event, feel free to drop your questions into the chat. I have my colleague here with me today, Maddie Atenise. She's our research lead with the Institute, and she'll be monitoring and collecting the questions in the chat for later today. And there may be some opportunities throughout for you to ask questions, and Omari will cue you for those as it comes up. Also, to keep things running smoothly, you've been muted upon entry. And so if you're not speaking, please stay muted just to minimize background noise. And if you experience any technical issues, just let us know in the chat and we will do our best to help. And also, quick heads up, as I mentioned earlier, our session is being recorded today. So you will be recorded and it's going to be available on our website. So if you miss anything or if you have a colleague that would, they really needed to hear this, it'll be available and you'll be able to grab it and take a look after this session. So with all that said, let's get started. Omari, first of all, thank you for being here. We are really excited to have you. And before we dive into our topic and your presentation, I would love it if you could just take us back to the beginning and tell us a bit about yourself. I know many people know you from the public health millennial, but how did that identity come to be? And what personal or professional crossroad maybe inspired you to start building that platform?
Good day, everyone. Before I answer that question, thank you, Claudia, for having me. Thank you, Maddie, as well as Trent, and the rest of the team at the Institute family. Very excited to be a part of this series and to share some of my thoughts. So, as Claudia was sharing, I am founder and CEO of the Public Health Millennial. I'm trying to think of the way to make this the least lengthy way to just share how all that started. But I kind of learned about public health later on in my career when I had already graduated from my bachelor's degree, and I was looking for after like failing to get some traction with Masters of Medical Sciences programs. I was looking for other ways to make an impact with my biology degree, and Facebook ads came across for public health programs, University of Florida and George Washington. I was like, oh, what is this? I've never heard of this in, I don't know how much years of life I was at, like 19, 20 years of life at that point in time. And I just found it interesting, but I still really didn't understand what public health was. I chose to apply to those two Masters of Public Health programs, got accepted to both of them, and decided to continue into University of Florida's Master of Public Health program. Within 2 weeks of classes, I knew that public health was where I needed to be, where I just felt I was aghast really that I never heard of public health, never knew about careers in public health. And now I was at a point where I was in a master's program in public health, and I was like, wow, this is amazing. Let me just try to soak in all this information and learn what public health is and how I can make my impact there. And then throughout my program, I did a lot of delving into learning about public health, going to the American Public Health Association conference, which really opened up my eyes to some of the many opportunities in public health. And I remember upon graduating from my master's of public health, I was able to get a community health fellowship in Alaska. I know Jenna is in Alaska, so shout out to my Alaska people. And it was actually on a road trip with a friend that I was telling them that, hey, like I really wish I knew about public health earlier. And I wish even when I got into my master's of public health that there were resources, platforms, people just sharing about their journey, sharing about how they're thinking about navigating public health. And they weren't any, or there weren't many at that point in time. So as I got to Alaska, as you'd know, the time difference there is, is pretty big for coming from the East Coast. So I just had a lot more time on my hands, as a lot of my friends would be asleep and then I'd be up. And I was like, okay, let me actually build out this thing. Can't even remember how I came across the name Public Health Millennial, but I just know I wanted to have a platform to share public health insights and give people guidance into public health and how they can navigate it. Started a blog, the PH Millennial, but then I was like, no one's gonna find the blog anywhere because there are a million blogs everywhere. So I was like, okay, I have to get this out some other way. So with the blog, I started posting on LinkedIn, and I also started an Instagram platform to kind of share what I was doing through the blog. Um, I was committed to putting out an article every week. It was every Monday I'd be putting out an article. I don't know how long I did that for. Definitely at least a year. And I got a lot of good positive feedback from folks and like, hey, like I wish I knew this. Thank you for sharing this information. And my goal on purpose was always to just help one person kind of understand public health, navigate public health. So it gave me the fuel to continue. The pandemic came, and then I pivoted to also include doing a podcast, Public Health Careers. And that really came out of me just doing a lot of informational interviews at the time and saying that, hey, I can do a podcast. I can interview people like more long form than the informational interviews I was doing and sharing that information. So I started Public Health Careers during the pandemic. Um, it's been 6 years now, and I've shared many articles, many insights, many interviews with folks in public health, and I'm still very excited, despite what public health is dealing with right now. Knowing that the skill sets, the perspective, the lens that public health has is so important and vital for improving the health of communities and families. And just continue to be excited to find new ways to share and guide people in public health. So that's kind of my path into the public health millennial.
Interesting. Awesome. So I know you've got a presentation for us today that you wanted to kind of take us through. I think that would be great. And after, all along, if people have questions, we can get to it. So yeah, if you want to share your screen, that would be great.
Absolutely. Give me 1 second while I share my screen, you all. And I cannot see you anymore, so let me know if you can see my screen.
We can.
Okay, awesome. So welcome everyone, and thank you for being here for the very first Mission InCommon webinar, from Fragmented to Fortified, Building Bridges for Family Well-Being. I'm ready to share my thanks to Claudia and team. Very glad that you all were able to host this webinar, and I think it's a very important time to have some of these conversations. The theme today is about moving from fragmented systems to fortified bridges, because families really deserve strong, resilient supports that work in sync and not in silos. And I'm excited to share some of the stories, data, and most importantly, some of the hope on how we can do this together. So I wanted to start with a little bit of a reflection. I want you all to think of one family, maybe close your eyes and think of that family, kind of envision what that family looks like for you in your head. It could be your own family, it can be a friend, it can be a community or a family that you serve in your work. But what makes this family feel safe, supported, and whole? Maybe just take a minute to think of a word or a phrase that really resonates as you're thinking about this. And I'll take a moment to let you all put in chats. I cannot see the chat again, so definitely let me know, Mari, if you're getting some responses. But I'll pause there for a second.
We've got stability.
It's a good one. Stability.
Together.
Together. Let's get one more.
Connections and relationships with the community.
Connections and relationships with the community. Well, thank you all so much for sharing those. I definitely think all of those resonate and are important aspects of making a family feel safe, supported, and whole. And as we continue in the presentation, I'd like you to keep this family in mind with you, the one that you envisioned earlier. This is going to be the kind of compass for the journey that we're going to go on today throughout today's session. So why families matter? Families are the roots of thriving communities, of thriving societies. When families are strong, our communities are strong. And when families struggle, the entire ecosystem feels it. Stories move our hearts, but we also need data to move the systems. And that's how we get to the real change. That's why we need both the story and the data. And let's remember that well-being is bigger than just one program. It's about your whole system and the families that live in that system every single day. We all know a family who is doing everything right, but the systems don't align and they're forced to jump through endless hoops. I can imagine that you all know one or many of these families. And I think this is important because we need to think about how do we create a system that supports families, supports the most vulnerable and high-risk families, and ensuring that we're not thinking about things in silos or just as individual programs allows us to really envision this in a holistic way. So what family well-being means? Family well-being isn't one program, and it definitely is not one-dimensional. It includes things like health, education, economic security, and belonging and safety. Health, because
Are
no
your
child.
I'm sorry, are your slides moving? Because
Yes, my slides. Are you not seeing my slides?
there you go.
So do you see it like this?
Yes, now it's moving. It wasn't moving before. Pardon that interruption.
Okay. And can you see it full screen like this?
I can, yes.
Okay. So as I was sharing, family well-being means that we're thinking about health, education, economic security, belonging, and safety. And when we think about health, because no child or caregiver should have a choice between prescriptions and groceries, education, because learning opens doors for the future, and it's one of the biggest determinants in determining our health and our outcomes. Economic security, because stability is the difference between opportunity and crisis, and belonging and safety, because families thrive when they feel seen, safe, and supported. If one of these pieces is missing, the whole family system suffers. I just wanted to make sure that my slide moved forward. So could you just tell me if my slide moved forward? Are you all seeing the North Carolina reality?
No. Mm-mm.
Interesting.
Having a little tech. Okay, now we are.
And do you see it as full screen, or do you see it with my slides on the?
I see it with your slides to the side. Yes.
Okay, let's see if I can. Okay, I'm gonna do this. I think this should work.
I think so. Yeah.
Okay, the North Carolina reality. I was expecting most people on the call today to be from North Carolina. As I've seen Jenna's from Alaska. So just maybe put where in the country or the world you are tuning in from. But just wanted to share some of the actual reality of things that are going on in North Carolina. And when we think about data, we have to think that behind every data point, behind every number is a family, is a person. A mom skipping meals, a child missing school, a caregiver fighting to keep the lights on. Families are resilient, but resilience isn't a replacement for systems that actually work together. So I wanted to ground us in some North Carolina data. In North Carolina, 17% of children live in poverty. That means almost 1 in every 5 children is growing up without resources they need for stability. Poverty isn't just about income. It shows up in food security, housing instability, chronic stress, and transportation barriers, as we know in public health. 1 in 5 children live in immigrant families. This brings incredible strength to our communities, but also challenges families when they face language barriers, cultural barriers, and a lot of fear of engaging with the system. And as we know, a system that is not too kind to them these days. 1.42 million North Carolinians use SNAP in fiscal year 2024. That's nearly 13% of the entire state relying on food assistance just to make it to the next month. 25% of K through 12 students are chronically absent. That's 1 in 4 children missing at least 10% of school days. And research shows that chronic absenteeism is directly linked to lower achievement, higher dropout risk, and long-term economic instability. North Carolina has actually set a goal for 11%, which would be a drastic cut in chronic absenteeism. And finally, more than 11,000 children need safe, loving homes through foster care. That's thousands of families under strain and thousands of children experiencing separation. And I want you to notice none of these numbers live in a silo. Poverty connects to education. SNAP connects to health. Housing connects to child welfare. Families experience all of these at once, but too often our systems only see one piece at a time. And that's why we need to move from fragmented to fortified. And now I'm having struggle. How do I go to the next slide? Oh, got it. So you may have thought of a family before, but I wanted to just briefly share a thought of a family that I kind of envision. This is not a real family, but meet the Johnsons. I would like to introduce you to them. They are a North Carolina family with 2 children and working parents. They're doing everything right, but because our systems don't coordinate, they're carrying stress no family should carry alone. So I wanted to humanize the data a little bit, and in doing so, I think it helps us just paint the picture moving forward. So the Johnsons, they're a 2-parent household with 2 kids. Both parents are working, but their wages don't stretch far enough. They make just above the cutoff for certain benefits, but still not enough to cover rent, food, and childcare comfortably. One child has asthma, so there are frequent school absences. The school flags the absenteeism, but doesn't know about the unstable housing or lack of transportation that makes getting to appointments harder. The pediatrician treats the asthma, but doesn't know that the landlord wouldn't fix the mold in their environment, or their apartment, I should say. Child welfare takes note of the school absences, but they don't connect to public health or housing, so they miss the bigger picture here. The family ends up being the glue, repeating the story again and again to different systems, and that's exhausting. That is what fragmentation looks like, and that's why building bridges matters in this work. So fragmentation. Here's a picture. We all know everyone cares, or I would like to think everyone cares, but disconnected systems mean families must be the glue, and that's not sustainable for the system nor for the families. Families are at the center, but they're surrounded by disconnected systems. As you can see, education is not connected to public health, is not connected to child welfare, it's not connected to community. What's missing here? Clearly, there's a missing of connection, communication, and shared outcomes. Each system has good people working hard, but they're working on different funding streams, different metrics, and different priorities. The result is duplication, inefficiencies, and gaps. Families are forced to navigate this maze and hold it all together themselves. Let me ask you, where do you see this fragmentation most in your work? Is it in how referrals are handled? Is it how data is siloed? Is it how families get passed around with warm handoffs? Think about that for a second. These silos create gaps families fall through. So we need to get rid of these silos. So the shift is to think about cross-sector bridges. Now picture the different reality here. The systems are connected. The systems talk, support, and reinforce each other. The family is no longer alone at the center. They are surrounded by shared outcomes. Instead of public health measuring one thing, education measuring another, and child welfare measuring something completely different, we aligned around family well-being. Stable housing, school attendance, and safety are the shared outcomes that we think about. Coordinated referrals with closed loop data. That means when a school refers a family to services, the referral is tracked, followed through, and outcomes are shared back. No more black holes or gaps for families to fall through. And we must have warm handoffs and family-led planning. Families don't feel like they're starting over with each new system that they interact with. Instead, they're accompanied, respected, and part of shaping the plan, and a holistic plan at this. And this isn't just a nice idea, it's happening in pockets already. And when it happens, families stop being the glue and the system becomes the glue. And this is what we should really look to work towards, building the bridges that create resilience. So I had a prompt for you all to answer. Where do you see silos most clearly in your work? And I'll pause for a second to see if anyone has any responses to this.
We have a few people typing in the chat, so I'll read them out loud.
Thank you.
Sonia said, I work in juvenile justice. We are often not included because people focus on their behavior and not needs.
Mm. Thanks for sharing, Sonia. Would anyone else like to share?
We have a couple people typing. I'll see if anything else comes through. Rebecca said, so many places. I'm having trouble picking one.
And I think this is the case too often, that our systems are fragmented and it creates challenges for communities and for families. And that's why I think this conversation today and thinking about how do we envision a system that supports families is so important. So I appreciate you all sharing. Feel free to continue sharing if you'd like. We'll move on. So why do silos exist? Silos don't exist because people don't care. As I shared earlier, we're all here because we care, and silos still exist. They exist because of structures that could be funding, accountability, even history or context of a place. But just because silos are real doesn't mean that they're permanent. Funding streams are tied to narrow outcomes too often. Organizations are using different metrics that don't line up across agencies or have a shared outcome. The turf and the culture that keeps us in our own lanes and keeps us competing instead of collaborating. And then there's a historic part of it where there's a lot of historic distrust that lingers across communities and in systems. These are all very real examples, but remember, they aren't and don't have to be permanent. We all hold some power to make changes to these silos and support and show up for our most vulnerable families. So what is the cost of fragmentation in our systems? The cost of fragmentation is high. It isn't just inconvenience, it's costly, traumatic, and inequitable. The human toll is way too high. Families have to tell their stories 5 or more times to different agencies. Kids fall through the cracks when systems don't talk. Dollars and time get wasted duplicating services instead of reinforcing them. And the highest cost isn't financial. It's the stress and trauma placed on families and their kids. What are the benefits of having bridges? When we build bridges, everything changes. When we build bridges, we don't just fix the systems, we restore dignity and save resources. Families experience dignity and trust. Resources stretch further. The outcomes are stronger across the board. Bridges are not just nice to have, they're essential. And that's why we have to start having more of these conversations and thinking about things cross-sectorally, cross-collaboratively, and open-mindedly. So I wanted to bring us to some North Carolina examples of things that are happening. I think a great example is the Medicaid expansion, which I'll get to secondly. And an okay example is absenteeism in Robeson County. So to talk about Robeson County at first, in this article, as I shared earlier, you know that chronic absenteeism is high in North Carolina. It is high in many rural communities. I think the percentage is higher in many rural communities across North Carolina because of barriers that we all know about, transportation, and other barriers as well. And one of the things that was lifted up in some of the work that I was able to research is the superintendent was able to make a great point that, quote, he said, "We cannot address this challenge alone. It will take all of us, educators, parents, students, and community members, working together with a one team, one goal approach to ensure that our children are in school and thriving." Some of the good that I saw in this situation was that it really highlights that transportation was a barrier. It also highlights that there is a community aspect of absenteeism. It's not just on the family and the schools, but the community is also involved and needs to be a part of the solutions. Some of the things that I think they didn't do as well or are bad is that they put some of the onus on the parents and the guardians while not understanding the systems that support or hinder progress. So we really need to think about not putting more on our families, but creating systems that make families navigating systems easier. So they did half right in a lot of what they were able to do. And then in Medicaid expansion in North Carolina, this was a huge game changer. Expanded Medicaid doesn't just increase healthcare access, it creates ripple effects across family well-being. More parents insured means more stable families, less uncompensated care, and healthier kids. And this was a long process. This was a 10, 15 plus year process to get Medicaid expanded here in North Carolina. And one of the things that was really important in this was having a broad conversation and understanding that having Medicaid expansion is going to improve the well-being of families, and that being one of the North Star goals for everyone that was working towards this. And then there was huge collaboration. There was the North Carolina Department of Health and Human Services, the North Carolina General Assembly, the North Carolina governor. There were nonprofits like the North Carolina Community Health Center Association, the North Carolina Navigator Consortium, and many other coalitions and grassroots efforts, not only working towards this, but sharing information on the ground so that folks know the importance of Medicaid expansion and what that means for improved health and well-being for themselves and their families. They were all on the same page. And though it took a decade plus for this goal to be achieved, we have to understand that we all have to get to the same page in order to achieve our audacious goals that we have. So these examples prove that bridges are possible and effective. They might just be a lot more long-term than we might have envisioned in our minds.
Omari, before you go further, I just want to underscore what you talked about bringing in the voices of families, because it sounds like that Robeson County solution was just inches away from being great had they brought in the voices of families. And the Medicaid expansion really did well because they did hear from families, but they heard from families and they also went back and informed families. So I really like what you said there about just making sure that families are engaged in solutions for themselves. I think that's important.
And to try to we had something in the chat that says we need to ask more questions and really listen to understand barriers and needs and approaches families are already taking. So going right off that point, Claudia.
Absolutely. Thank you for raising that as well. I think that is very, very important. And I think it's important to have the conversation about, okay, this has happened, what's good, what's neutral, what's not so good, so that when we are in positions of power or influence, that we are able to view it from the system lens and not put the burden on the family, but put the burden on the system and think about how can we create a system that really supports these families. So thank you for that. And I wanted to talk about some national inspiration as well. So there's been a lot of work that's going on nationally. I feel like there are probably hundreds of examples I could go on here, but I wanted to highlight these four. The first one being the Family First Prevention Services Act that was passed in 2018. This was legislation that allows child welfare dollars to be spent on prevention. So things like mental health, substance abuse treatments, and parent skill building, instead of only funding foster care after removal. This really invested in keeping families together and supporting families in being together safely. Next is Healthy Start, a federal initiative that most of you are probably familiar with, that targets communities with high infant mortality. It uses wraparound supports, so prenatal care, mental health services, housing help, transportation. It's a model of how public health, clinical care, and community supports can align to really bolster and lift up our families. Then there's the Accountable Health Communities, This was a pilot program that screened patients for social needs, so food, housing, and transportation, and connects them to community resources. This is a structured way of bridging healthcare and social services. And I think having more of those conversations and less silos is so important. And then most recently, universal childcare in New Mexico. I think it first began in 2022, but there was just legislation, I think last week or something of that sort, or at least there's publications that came out last week that guarantees free childcare for all families within New Mexico, regardless of income. This bold policy reduces stress for families and strengthens workforce participation and really builds stability at scale. Each of these models shows that bridges are not only possible, but they're scalable and they can be built into the policy and the systems around us. So we really need to have a shift in mindset in our work. We have to go from to. So this isn't just about tweaking programs per se. It's about how we shift, how we think, how we talk, and how we act. We have to go from programs to think about to people. We have to go from silos to systems and collaboration. We have to go from outputs to outcomes and from activities to real impact. It's not just about what we do, but how we do this and how we operate together. And this starts with conversations and many times shared language and shared goals. So this is actually going to be a longer slide. I had a lot of detail that I wanted to put into this slide. Wanted to make it a little action oriented. So these are 3 moves that you can start to build bridges tomorrow or even today if you'd like to. Just wanted to highlight before I get into that, like all big changes start with small, consistent actions. I'm not asking you to build the Great Wall of China, but just take the next step in front of you. And as we take that next step, we will all be moving towards a path of shared goals and fortified families. So here are 3 things that you can start tomorrow or today. Shared language. Talk about families, not just programs that you work in. Too often we talk in program language instead of family language. Public health talks about population health. Education talks about attendance rates. Child welfare talks about cases. But families don't live in these programs. They live in the reality of the world. They care about what families care about is my child safe? Is my family stable? Can we make it through this month? If we shift our language from program outputs to family outcomes, we immediately start building bridges. An example of this would be, instead of saying we reduce chronic absenteeism, say more kids are in class learning with their peers because families got the support that they needed. Shared language makes it easier for partners across systems to align around a common goal, family well-being in this case. Story and data pairing. You have to lead with a story, but you have to follow with a stat. Data is essential. It convinces funders, leaders, and policymakers, but it doesn't move hearts on its own. Stories are what move hearts. But if we only share stories, some people would say that's anecdotal. That isn't in the data. The power is when we pair the two, the story and the data. An example of this would be start with a family story like the Johnsons, as I shared earlier. They struggle with balancing work, school, and health. Then drop in the data. 25% of North Carolina students are chronically absent. Suddenly, it's not just one family's problem, but it's a systemic problem that we're dealing with. This combination makes it impossible to ignore. It builds the agency and it builds the consensus around or across sectors that this is the issue that we need to tackle now. And then lastly, micro bridge rituals. This could be something like a monthly cross-sector huddle or one shared metric across partners. Systems change doesn't happen in conference rooms. It happens in small, consistent practices that build trust. So some examples of micro bridges, as I shared, could be that 30-minute huddle with partners across systems just to get everything aligned and all checks and balances. Or you can choose one shared metric across different agencies, for instance, chronic absenteeism, food security, or housing stability, and using that to bring each other together and collaborate and to create a system that is supportive. And these rituals don't take much money, but they do build trust, and trust builds bridges. These are simple, but they build momentum. And the key here is you don't have to wait for top-down change to start. You can shift your language. You can tell stories alongside data. You can start building a ritual in your own context tomorrow or today. And when hundreds of professionals across North Carolina and the country start doing that, the whole culture begins to change. That's how fragmented systems become fortified for the families that live within them. So some barriers and solutions. I have to acknowledge that barriers exist, but every barrier definitely has a bridge solution. So when we think about the barrier of funding, how do we think about creating braided pools or working collaboratively to go after funding streams? When we think about the barrier of metrics, how do we share dashboards and align on outcomes or have one shared data point that we're all working towards so that there's that air of collaboration throughout the different organizations? And then when we think about the barrier of collaboration or different culture, we have to build relational trust through joint training and collaboration. We have to ensure that we are showing up as our persons and really having those conversations to understand how we can make those bridges and move things together. We can all name the barriers in our work, but then I think we also have to get to work on the solutions, name the solutions and work on the solutions. So I have another prompt here for you all. Now, what's the biggest barrier to collaboration in your context? Take a moment to share in the chat, and I will wait for Maddie to give me the go ahead.
Well, people are typing, I'll throw one out there. I think this is why this conversation is so great, because sometimes you don't even understand how another system can help you collaborate to help a family. So it's as simple as just education on an issue, education on the different things that are at play, and like you're saying, the barriers and what might possible solutions be when you do work with other people.
Absolutely. And I think like predating that understanding is being able to show up in a room and be honest about the challenges and the successes and being open to know that we aren't going to solve these issues by ourselves.
Mm-hmm. We have some answers coming in. We have Sonia said fear of youth. We have one that says, this is how I try to approach my work, but sometimes trying to collaborate with others in this way results in them being more competitive. We have another that says, what seems like competing priorities and time.
Time is a big factor, I think. People are busy. Yeah, collaboration takes time.
Yeah, and then funding and resources, mutual aid would be a good bridge. A lot of good answers in the chat for that one.
Agreed. Oh, let's see more things coming in, I think.
So you just clarified fear of our youth and juvenile justice specifically, not youth in general.
Well, thank you for sharing those. I think it's important, firstly, to name what our barriers are so that we know what they are, and then we can move forward to overcome those barriers, build the bridges, and have conversations where we are not siloed, but thinking and working in systems. So, kind of going back to what I shared just now, I would like all of you all, I want to make this as actionable as possible as well, to build a bridge, want to make it practical. So in the next 30 days, who's one partner you can call? What's one metric that you can track together with another organization? What's one family voice practice you could adopt? Feel free to drop it in the chat, but I would love for you all to take one of these bullets and action on it, just because, as I was sharing before, the systems don't change unless we do actively do things to change. And the small things that we do add up to big changes in the end. So I think we all have an onus to say, yes, the system is broken. Yes, it's siloed, and I'm going to take up my part of this system and build this bridge to have that shared metric, call that partner, or really voice the concerns from the family's perspective. And as I shared earlier, this doesn't have to be huge. It could just start with a micro bridge. Consistency beats scale. We know that many of the challenges we face today are challenges that have been faced for decades. And we need to show up consistently over the next few decades so that we are able to best tackle those challenges. We have to take agency and action into our own hands, even if it's just small action. And that's how we get the good momentum to cause the good trouble in these systems.
I want to share, Jenna just shared in the chat, which I think this is a great idea. And I love how we are already again thinking about this, that she's over the youth risk behavior survey for Alaska. And when they have their questionnaire development process next year, she's going to reach out to her former CPS colleague and invite them to collaborate in that process. Sonia said we have started family partnership facilitator training for staff in juvenile facilities with 2 of our lived experience agency partners. We trained 16 people a couple weeks ago. It would be good to develop an infographic showing this increasing over time. So love that prompt already got us thinking about stuff.
I love that. I
love that. Yeah, I just want to add right quick. One of the things I like about it is kind of like when what Omari said about the micro bridges. It doesn't have to be. We keep waiting for hey, we need to apply for this huge grant together. It doesn't always have to be at this high level. I think sometimes when you connect people who are right there doing the work in front of families, you get the most impact. And all of those solutions talked about something that was right there on the front lines that could really have real impact for families, months down the line as opposed to years down the line. So I love what people came up with, and I like the idea of micro bridges a lot.
Thank you for sharing that. And I would even say that when you say come together for big funding, I feel many times when funding comes into the picture, before there's that collaboration, before there's that trust, it creates more of a competitive environment. So that's why it's so important to call the partner, build the bridge, have the conversation before the funding is there so that everyone is understanding that, hey, we're not really competing for this funding. This funding can be used to support all of us. And really have to think about it collaboratively, because there's no one organization that is going to solve the systems of problems that are out there. So I appreciate you all sharing that. So this is the vision. This is where we want to go. Families not just surviving in the gaps, but thriving inside a circle of care. Families at the center, surrounded by a fortified system: public health, education, child welfare, housing, economic security, community, and whatever else that you can think of. Every system not only connects to families, but it connects to each other. It's no longer fragmented. It's a circle protecting and supporting the family. Imagine the Johnsons in this model. Their child's asthma triggers a warm handoff between school and public health. Housing knows about the mold and fixes it, reducing the absences. Child welfare doesn't need to intervene because prevention worked. This is not utopia. It is achievable. if we commit to building bridges and micro bridges and then build bigger bridges from there. No one is stopping us from building bridges. Let's do it for families. The work that we do is hard, but the power is in this room right now, and we can do this. We have to show up for families and the communities we care for. No one is stopping us from building these bridges. Not policy, not job titles, not funding streams. The only question is whether we'll step across the aisle and do it. And we can, and we have to, for families. That was the closing of my presentation. Thank you all so much for tuning in today. My name is Omari Richins, once again, CEO and founder of the Public Health Millennial. If you'd like to contact me, that's my email. Be sure to connect with me on LinkedIn. If you'd like to join my email list, phmillennial.com/sign up. And if you'd like to join my free public health community, the phmillennial.com/join. Would love for you all to join or find ways to continue this conversation, because it's so important. And this is just the start. I believe I have one more slide. Yes. So return to the family you thought of. What bridge will you build for them? Oh, sorry. Sorry, my iPhone's listening to me across here. So, sorry. Return to the family you thought of. What bridge will you build for them? When we move from fragmented to fortified, we don't just strengthen systems, we strengthen families. Thank you all for taking time for being here today, and look forward to any questions or conversation that we'll have. I'll stop sharing.
That was really just awesome information. I saw a lot of head nods and applause and all that kind of affirmation for what you were talking about. It was really important information, and I just think really useful. Do we have any questions? If anybody, wants to come off mute, or if you want to put it in the chat, we've got Omari here with his great ideas and big brain. So yeah, let's find out. Let's pick his brain and see what else we can dive into. And if nobody else, I can just kind of kick it off while people are thinking about their questions. But you spoke earlier just about like the competitive nature and just having I think a lot of people in their hearts, they want to collaborate, but we've got barriers, we've got time barriers, we've got issues with competition, people not knowing where to start, and you talked about just those small ways that people and professionals can come together. Do you have any suggestions for once they do that, for taking informal things and turning in, kind of formalizing them and making them solid so that they can, kind of grow and expand from there?
It's a great question. I think the first thing that comes to mind is like just having the conversation with other people, because we are, everyone here has a certain perspective, certain view, is doing a certain work, but we need to be able to understand how that work interacts with person next door's work and the other organization's work. And I think having those conversations doesn't have to be anything big. It could be short check-ins, and I'm not asking for anyone to go out there and build an entire new system themselves, but understanding that like taking the small actions really does add up in the end to building something that is supportive and where collaboration can happen more naturally, authentically. I think is important.
Yeah. Awesome. Maddie, did you have anybody have any questions that they wanted to share? I didn't want to hog all the time. Yeah. So okay. Yeah. So I guess because I think one of the things that I'm thinking of is another thing that you talked about was just the significance and the centralized aspect that education and schools have in this. I'm a former educator, and so all of your examples that sort of related to that resonated with me, especially when it comes to sharing outcomes and that sort of thing, I really think that we have some opportunity here to figure out how to better bring educators in the mix and how to make sure they understand all different aspects of the different sectors that can be involved in, and also what their impact is. And so I didn't know if you had any suggestions for each sector, and like what should each sector know about the other, I guess, or try to find out about the other in order to be really effective collaborators. Like something as simple as the school calendar. When I worked in education, so many people didn't even know when the first day of school was. And that changes everything when a family has to spend all their money on school supplies and new school clothes and school lunches, or the last day of school when all of a sudden I have to be responsible for food all day when maybe I had a resource. So talk to me a little bit about things that you think each sector should know about each other in order to collaborate effectively.
That is a great question again. And as you were sharing about like the educators, I feel like educators are in in interesting space in that, of course, a lot of them are like time burdened. They don't have as much time, they don't have as much resources. And I think it should be on each one of us to approach whatever institution, to maybe talk with the superintendent, the district superintendent, the school principal, to just kind of understand where they are, what are the things that are important, what are the challenges that they're seeing, and seeing if that has overlap in the work that you are doing, in how you're thinking about the strategy. Because as I'm like thinking about the question that you're asking, it is kind of the question of the presentation is moving from all our individual programs to thinking about the family as a whole, and what does that family need to feel supported. And in doing so, is thinking, what are the goals of each organization for the family? Like what are their top 3 goals or top 3 priorities that they're maybe trying to achieve, and understanding where that is, understanding what data different folks are collecting, and maybe how that intersects with your work, or how you can maybe try to find ways to share data, I think is important. And then to your point, like knowing important dates, like are there important dates that are influential? Like for example, here in North Carolina, knowing when the General Assembly is going to meet. Like these are important dates that have huge leverage points for different change. And it doesn't have to be something that huge. It could be, as you said, like when the school starts, when it's spring break, and just figuring out where every agency or every organization or every program is, and seeing where there's alignment, because more often than not, there is going to be a place that there's alignment in the work that we're doing, and thinking about how we can continue to have those conversations to move forward the overall goal. Because I would say most of us here, the goal is, most if not all of us here, the goal is to like improve lives of some sort of community, whatever population that is. And that could be focusing on education, on health, on transportation, on juvenile justice. So how do we come together and think about our goals more shared or more aligned? I think is where my head is at on that question.
Sounds good.
Speaking of kind of on that alignment sustainability portion, Brown asked a good question. What are the best practices for promoting sustainable initiatives during periods of policy change, especially when those changes may not align with the best interests of families?
Can you repeat that one more time?
Yeah, of course. So what are the best practices for promoting sustainable initiatives during periods of policy change, especially when those changes may not align with the best interests of families?
Yeah, this is I feel like something that a lot of us are thinking about right now. Best practices for promoting, and I would say it's hard. It's hard because a lot of the work that we do, we hope we hope that we live in a society where our federal government takes care of the things that we as a society thinks is important and supports those programs and initiatives that are important. And when there is that misalignment in what is important and how that flows to families, it is challenging. And I don't know if I have an answer for that, because I think that is a challenge that many organizations that I speak with are facing in today's climate. Is like, we want to do this work, the federal funding or state funding or whatever funding to do the work mightn't be there. Yet this is still very important, and it might even be even more important in the coming years as policies impact the families that we're working with.
But don't you think the collaboration is kind of like the first part of that? I think, because you know, back to that trust and collaboration you talked about earlier, I think it's a unique opportunity to share resources and build trust, because as things, you know, change, I think we have to change with it. Because families will need help either way. And so I do like the ideas that you talked about. I mean, I think maybe the first step is just not trying to do it alone anymore.
And speaking of that trust and sustainability, this question, I think, goes off of Brianna's a little bit, because we talked about this a few times in that community engagement, like that's not just about us as professionals, but talking to community members. So, and I know one of your big things is you talk and you have conversations, because that's important to have conversations with other professionals and people. And you mentioned earlier, vulnerable population. So how, as professionals, public health practitioners, system leaders, can you ensure that community engagement efforts are authentic and not tokenistic in the way that they're performed? Because again, especially in those marginalized communities that you talked about beforehand, where there might be a historical significance with having those conversations. So we want to include them, but how do you, in your experience, make sure that is authentic and not just seems like you're checking something off a list for a family?
That's a great question. And, you know, trust is the number one thing that is so important in being real and authentic in the communication that you're doing. And trust happens at different speeds for different people at different times. So there's no one answer, but trust is part of a relationship. You know, all of us have relationships in our lives, some of them better than others. And we support a lot of our relationships based on the trust and with the consistency and with the showing up. One of the things that I think is so important is not only having that trust, but showing up, you know, seeing that you're doing something and then doing it, and then following back up, and then having those conversations with the folks to really know that, hey, this person isn't just here for their project or to get the tick on for their grant or whatever it is. They're here because they care about our community, and they're showing up in our community, and they're showing up for me in ways that might even be related to the project. Maybe it's something, or maybe somebody needed a ride somewhere. Like those are things that are so important. I think another part of that would be shared power. I think too often we as public health professionals or professionals in general think that we know all the answers. We should be the persons making decisions. But we really have to understand that a lot of the solutions and a lot of the solutions that we are seeking are in the families, are in the communities that we are working with. So like, how do we share that power and create a space where they are able to also be honest and real with us, whether that's things that we like or we don't like, and being okay with hearing the things that we don't like, because that also builds trust. And I think two other things that I'm thinking about are like continuous feedback. Like, just like in public health, one of the things I really love about public health, or at least the perspective of public health, is, you know, you go in with listening to the community. You go in with like an open ear to So yes, you have your expertise, but the community is the expert on what they need at the point in time. So really going in just to listen and to create that space for them to share, and maybe even share like, hey, did I show up in this meeting the way that you wanted me to, or was I too assertive? How can I show up to really elevate your voice and not just like speak on sometimes you do have to speak on behalf of community, but I think you want to be able to get to a point where you're building enough capacity and trust in community where you create that space for them to share authentically, and you also create this space to protect them from like different attacks that they might get for showing up authentically, because many times they might be speaking against a system or a program that might be in the room that might be well funded. So you have to know the place and space that you're in to really engage with them there. And then I think understanding that there is mutual benefit. Yes, we have our jobs and our roles and we're trying to achieve something. Families are also trying to achieve something. How can we figure out where that synergistic middle is and find partnerships that honor those lived experiences and really build momentum on that?
Thank you. That's a great answer. Then speaking of the context expertise, I love how you mentioned that, because, you know, as professionals, we are content experts in our field, but the families that are living and breathing these issues they are the context experts. And if we don't bring them into authentic ways, then we'll really never truly understand what is going on in communities in North Carolina and in Virginia and Alaska and across the country.
Absolutely. And then the last thing I'd say there is, you know, the systems that we have now were built oftentimes without the input of community and the persons that are most impacted. So how do we re-envision a system or a way in which those persons that are most impacted, most proximal to the issues are able to have power on those tables and have a voice at those tables and are able to share their solutions and be respected for the solutions and the input that they share.
That's a good point. One thing I'm curious about, you know, you talked about starting your origin story, you know, not knowing, you know, about public health, you know, and I know public health is something more people have talked about probably in the past couple of weeks than ever before. But I think it's a unique opportunity to perhaps call people to the profession. I mean, you know, because it's like you didn't know about it. When you think about people who are thinking about a career in public health, young people who are out there, you know, trying to figure out what they want to do, their impact in the world, you know, what advice would you share with anybody who's like starting a career in public health, thinking about a career in public health? I think it would be interesting to get your perspective on that as a young person.
Yeah, insights into career in public health. I still believe in my heart, and I don't even like view public health as I do view it as a field, but I also view just public health as like this lens and this perspective on the world and how systems kind of like correlating and interrelated in how they work, and thinking about like injecting community into that. I would firstly tell people that are in public health or thinking about going into public health that the traditional path of public health has been devastated in many ways, and though it's devastated, there are so many opportunities out there to still make impact. It just mightn't be in the same place or in the same way that you envisioned at first in traditional public health roles. But considering what is happening on a federal landscape, we know that health inequities are not going to disappear just because you aren't collecting data on race or on place. So I unfortunately I envision that like public health professionals are going to be even more needed in the future than they are right now, because a lot of the issues just being invisibilized right now, and the invisibilization of the issues doesn't solve the issue. So there's going to be work for you, and there is a lot of value in the public health field. More tactfully, I would say, if you are thinking about getting into public health or early in your public health career, relationships are huge at this point in time. Like, just having conversations with folks, getting kind of clear on what you envision your future in public health looking like, who are the folks that are doing work like that, and talking with them to kind of learn more about their path, learn more about what they're seeing directly in front of them, and then looking to also asking them, like, what are the skills, experiences, knowledge that I should have to make myself the most impactful, the most competent candidate and public health professional, and really using that to kind of craft your plan into thinking about what your career in public health is going to look like. Because if you're interested in biostatistics, or if you're interested in health policy, if you're interested in working in health philanthropy, those are vastly different paths, and understanding that there are specific skills and experiences that are going to be more helpful than others. And then one thing I tell everyone in public health is, like, public health is so broad. You might know if you want to go into biostatistics, health policy, health philanthropy. So try to find ways to get your toe in the water, like test things out, whether that's internships, volunteering, doing projects on the side, informational interviews, and really trying to figure out, like, where you want to go and work backwards from there. In my 9-to-5 role, I'm a health program officer. I had no idea that role existed until after I graduated from a master's of public health. And I think that's the case for many people now in public health. Like, you have no idea what your role is going to be, but you know that the skills, the experiences, the perspective that you have is valuable, and just knowing how to apply that is important.
I think that's awesome. And thinking about, even what you do, I mean, the role of technology and social media, even as you talk about micro bridges and all of that. I mean, talk to the group about ways that they can build communities themselves. Like, you really don't have to wait. You can begin through LinkedIn or some other social media platform. I mean, I don't know. I think that's something that would be interesting to hear about as well.
Absolutely agree with that. I definitely think, like, whatever you're dealing with right now, other people are also dealing with. And I think in that there is community. I had a public health happy hour Tuesday of this week, and someone was talking about how they graduated from their bachelor's degree, and they've been out graduated from the bachelor's degree like maybe 3-4 years ago, and they're really struggling to still get their foot into the public health realm. And in the chat, all us like, me too, agreed. I'm here too. And I think we discount our experiences and think that we are the only people dealing with whatever it might be at the time. But there are so many other folks out there that are experiencing things that are similar to you. And the best way, in my opinion, to find those folks is by either sharing or asking questions around those things that are important to you, and you don't have to build an entire public health brand or anything like that, but there's still so much value in just showing up for your community, sharing what you know from your perspective. And that's one of the things too for the beginning of the public health millennial is like, oh, should I share this? This seems pretty obvious to me. But just because it's obvious to you doesn't mean it's obvious to everyone else, because you have your own lived experiences and your own path. So I think in just sharing information, asking questions, and that's how I started a lot of the public health millennial, was just asking questions in the LinkedIn community. Hey, is the CHES or the CPH better in your experience? Hey, well, if I wanted to get a health policy, what are some organizations? Just from putting things into the interwebs, into the world, I think you would see that people are going to find you. Your people are going to find you, and in that, it's so much easier to stay what's the word I'm looking for, to stay not confident, but to stay like, so, oh yeah, I'm going to keep on doing this. I'm going to keep on doing this. When you have other folks who are there with you, who are maybe experiencing similar things. So really, I think just I think everyone has a place to build their own community, whether that's 2 people or whether that's 10,000 people. And there is power in that community from just sharing from your perspective. So that's kind of where I am. And I'm always happy. I feel like I always think back to especially my time during like the pandemic. Even though public health was at the forefront, there still aren't as many like public health influencers or content creators. I'm more like to refer to them today. But when you look at like medicine or nursing, there are so many folks out there that are doing that. So there's still so much space, I think, for public health to develop and to create a space for people to create community and share information and just be in community with each other. And I'm happy to help folks with that, hoping to host some workshops more around that, either towards the end of this year or next year. But definitely think there's a lot of space and a lot of value in showing up and creating your own community, whatever size that is.
Great. I think that's good, especially as we talk about cross-sector collaboration, because it all starts with relationship. You can't even begin to reach across a sector or reach into another system without relationship. And so I think it's important when people go to conferences, when you go to events, when you're on your LinkedIn page, like reach out and meet people and talk, and you may be surprised at what you learn. Maddie, do we have any other questions? Did anybody else have questions? I didn't want to close without giving everybody an opportunity to ask.
I think that was the questions in the chat. And I also just included the Institute for Families work streams for engagement post-webinar, and I'll include my email just in case anybody, if y'all come up with questions, send them to me and I can always get them to Omari. And that way also, if you ever think of a collaboration opportunity too, you have our email to reach out.
Awesome. Well, just thank you all for joining us today for this Mission in Common webinar event. This was an incredible conversation. I think it was filled with insight and inspiration and imagination for, what's possible when we approach public health, not just as a system, but, as an ecosystem, right? And so just a real deep thank you to Omari Richins for sharing his expertise, his origin story, and your vision for, what's possible in our communities, and really for your commitment to health equity. You've helped us see how family well-being is just intricately involved and tied together with what families need to be successful and to thrive, and really for communities as well. What happens with families happens with communities, happens with our states, happens with our countries, happens with our world. So we just can build from there. So every little bit helps.